Okay, so this last part is really about strategies for finding data or getting data if it's not readily available. And you know, the real limitation, as you probably figured out, right, on whether or not data is available is going to be the population of your area. Because survey data, any kind of sample data, anything like that, in order to be able to report it, there have to be a certain number of people sampled, right? A certain number of respondents to a survey. If there aren't, then there are issues with the data. I mean, not only can you get into issues with data having to be suppressed because it could identify someone, but you can also get into issues with the quality of the data. Because if you've got two people in a county that identified themselves as, you know, fitting a certain demographic, and it's the more specific you get, the worse it's going to get. So females, Hispanic, within this age group who have two children and on, well, there may just be two people, and you can't really extrapolate that to your whole county, right? The confidence interval, the certainty you can have about that result is just, it's too uncertain. So it really is population that is a big limiting factor in terms of the data that's available. And even in these strategies, you're going to see that's true. So Chris and I are going to kind of go through this together, and I'm going to talk about some different ways that data can be combined and made available to you. And then Chris is going to show in tandem with me kind of where that is on our website, because all of this is available through us. So aggregation. You know, it's frequently in the BRFSS runs into this a lot, and any other survey or sample would as well, that in a single year, there just isn't going to be enough people surveyed, respondents, whatever the case may be, to make that a reportable statistic, right, a reportable number. But it is possible for smaller communities, smaller counties, et cetera, as long as there are 65,000 or more residents, then these years can be aggregated together. So rather than a single year, it could be a 5-year stretch. And that's certainly true with the American Community Survey. So ACS, these are data estimates. So again, this is stuff that's already happened, right? And so ACS is administered by the census, and again, for counties with 65,000 or more residents, you can aggregate the years. When you do that, it can help overcome the whole problem with validity of the data, right? It can shrink the confidence intervals and give you more certainty in the values that you're looking at. Year aggregation, merging years is also possible and common with the BRFSS data. And again, that has to do with, what is it, Michelle? It's 10,000 residents, isn't it? Yeah, for oversampling. But again, if there aren't enough people sampled in a particular area, then if those years are merged together, sometimes or frequently, you can end up with enough samples. Go back. Oh no, you're there. Mm-hmm. Okay. And then another thing that you can do is merge areas. So rather than merging years together, right, aggregating years into single values. Chris is messing me up here.
Sorry.
Thanks, Chris. See,
I was going to go to the...
Okay, so you can merge areas together. And I'll talk about it more specifically, but the public use microarea data, so PUMA, is based on ACS data. So the American Community Survey is administered by the census, right? And then because of the limitation with the number of residents that have to be in a county, you may find yourself in a situation where there just aren't that many people in your county. I mean, I think most of the people in here that wasn't true for. And so what they do instead is they take individual census tracts and they aggregate those into one group of a population of 100,000 people, so roughly 100,000 people. And they do that every year based on this community survey, which is also administered every year. And so the community survey itself is kind of a replacement. I don't remember doing this, but you know the long census form that, you know, like 1 in 6 people filled out? Well, the ACS was really meant to replace that. So everybody does the short one now, but the ACS is really the one that looks at particular characteristics of a sampling of households that respond to the census. So looking at health insurance, poverty level, a lot of socioeconomic factors, you know, the questions are very specific to that. Okay, so if you, yes, so Chris is going to go ahead and show you those two. So he'll show you The ACS site, he'll show you, we've kind of already looked at BRFSS in terms of what's available on the CHS site, and then the PUMA data as well.
I actually kind of showed you the ACS data when I showed you American Fact Finder and the 1, 3, and 5 year averages. You know, that's how they added up years so they can get a sample size big enough so they can do it. But I haven't shown you PUMAs. PUMAs are, and that's how I messed up Anne. Let me go to pull up the ACS census site. This is something that anyone can do, but under data and documentation, they have public use microdata samples under data and documentation. They also have guidance. So they have all these sorts of handbooks for data users. And one of them, the handbook is solely just on how to use PUMS data. I'm actually very, very, very familiar with this. And I've written programs and functions to deal with this. The data for Texas is on the order of hundreds of megabytes. And you kind of have to download all of Texas. But you can, with this, if you wanted to, for instance, you saw those tables in the ACS or the American Fact Finder. But if you wanted to know vision difficulty by age, by economic status, which was not a table in the ACS or American Fact Finder, you can get that with the public use data files. So you download the file, and it's a big file, and you might want to call me on the phone. And you really just actually add up all there's different variables. And so there's a sex variable, and then there's a poverty status variable, and then you basically just start subsetting the data set by whatever you want, and then you add up all the estimates. So if you only wanted females, you know, like, have you guys ever used Excel and they have the function, it's auto filter? Effectively, that's what you're doing, right? Like, you just take the file and you kind of auto filter females, right? So you only have females. I wouldn't use Excel for analyzing this data set, but it's the same idea. You auto filter, you only get females, and then there's this estimate category. You just add up all the things in the estimates, and there you have the population of females in Texas. But we really don't want that because that's a reported. So you want like the females in Texas that have a certain economic strata, and then you start subsetting the data. So you only get, 10 people or 50 people. You just add up all those estimates, and then you get the number of people. But all those are available here. And it's the ACS data. It's the public use microdata sample data set, and you can get different data sets. Don't worry about these ones. Only deal with these ones. But there's 1 year, and there's 5 year, and 3 year. So every year they release a new 1, 3, and 5 year. And the 5 year is 5 times bigger than the 1 year. And so, and I'm just clicking through, like once I selected it, it says, give me the public use data files. And you click Texas. And it's, okay. This one isn't that big. It's only 17 megabytes compressed. So it's probably only 70 megabytes uncompressed. You don't want to open in Excel. But it's totally a doable option if you have the time.
And there's a lot of this stuff too that we help people with all the time. It's not as though, you jump in and have to, I'm sure Chris does and Michelle does and I do too. Even if it's not my data, even if it's not my service, I'm not just going to abandon you, right? If you happen to get in touch with me first, everybody I know in the center will help you through the process. I'll go and talk to Michelle about what data she's got available. So it can be pretty overwhelming. It can be pretty overwhelming. Do that, right? There's just tons of data up there. But almost anyone you talk to, whether you get in touch with the GIS team or Chris or whoever, I know that in multiple instances we've all helped people kind of navigate through what data is available. And if you need to go to another program within the agency, identifying who that person would be for you to contact. So there are a lot of different ways to find the data and get the data without feeling like you just have to be overwhelmed by it.
Sorry, the person file was 45 megabytes uncompressed, or compressed. So it's about 160 megabytes uncompressed. It's a big file. you have the time and I can help you, we can work with it. Or you can work with me and I can send you some scripts and help you. And you can deal with it. You just can't do it at 4 o'clock when you're trying to 5 o'clock deadline. Oops.
Okay, so that's aggregation, right? So aggregation, that's one thing that can happen. And there's a couple of maps here. You know, I wasn't allowed to talk about GIS. I just want to mention that. And I'm a little bitter. But I did create some maps. But anyway, the point is that with aggregation, so this is BRFSS data, right, for 2011, counties with 50 plus respondents, so that can be reported. And you can see the blue color is that data available for a single year? And as you can see, very few counties, right? So again, it's population that's going to be the limiting factor here. So, but if that data is aggravated, like Chris aggravated me. So if it's aggregated, so this is a map now showing the counties with the number of respondents that's needed for 2007 to 2010, right? And obviously that makes it a lot more, it's available to a lot more counties than it otherwise would have been. All right. So another thing you can do with BRFSS data besides aggregating years would be oversampling. So oversampling, again, this is a telephone survey that's administered. In the telephone survey, they have a core set of questions that get asked every year. And then you have groups that maybe have specific questions they want to have added to the survey. So that can be done. And another thing that you can do is have what's called oversampling. So rather than the standard number of people they might call in your area, you can pay to have more people called, right? The limitation here would be is that you would have to have a population of at least 10,000 adults. But if you do, you can pay to have more sampling done and hopefully then be able to get enough data that can be reported. So 2 issues associated with that are the cost. So it's $64 an additional interview. Okay, so and you're trying to hit a CDC target, which is about 500, 550. So that's the CDC suggested target for how many you get. So if you're at 495, right, well, it's not too much more money. But on the other hand, and again, here comes population, if you've got 50, then to get to 500 can be really expensive. And you know, typically in smaller counties with few people, the resources aren't that great either, right? So this can be done, but it's not necessarily going to be a viable solution for a lot of people, probably.
I'm not sure the oversampling.
Yeah.
And we do oversampling, and it is on our website, in fact. Some of this data that's been oversampled. Let me go to our... Interactive surveys. This is the BRFSS webpage, but you can see on the left-hand side is interactive surveys. There's this interactive survey results, which I showed you earlier. And then there's BRFSS oversamples. And so these are areas that were oversampled. And you see the area and the years. So a lot of these are metropolitan areas, Bexar County, San Antonio. The Big Bend area is not metropolitan in any way. Let me pick up that area. And because they oversampled, they got more than 50 respondents in an area, and so they can start reporting data. Whereas before, if you're familiar with this area, it's like in that whole region 10, is what we call region 10, 92% of the population is within El Paso. So there are very few people in that region that aren't in El Paso. This region does not include El Paso. And here are the counties within, and those are not the most populated of counties. But because they oversampled the area, they are able to get estimates for here's alcohol use, binge drinking. This would not have been possible without oversampling the area. So, and these are all, but you need, the thing about the money cost is that if your area is normally gets 400 surveys, and you need 100 extra to hit that 500 threshold, so you're paying for 100 extra surveys. But if your area only gets 50 surveys, you're paying for 450 surveys to get to that threshold. So these are areas that have been oversampled, and you can see them on our website. It's an option. Can we go next slide?
Okay, so a couple of other solutions for getting data or other ways to get data if it's not readily available are synthetic estimate modeling. So this can be done, it's done by both the CDC and the census, or actually I think BRFSS does some synthetic modeling, or diabetes program actually within DSHS does synthetic modeling using BRFSS data. Okay, so it's available for the BRFSS data, obesity and diabetes. It's utilized by a lot of DSHS programs, the diabetes program. Limitation. So, any kind of estimating, any kind of modeling is going to have error associated with it, because what you're doing is you're trying to find different factors or inputs that you think are, well, not predictive modeling, but estimates are kind of, are going to result in an accurate figure. But a general limitation of this is that it assumes the community and the state are similar, which may not be true, right? It's just like, I don't remember your name, but from Beaumont, he's talking about they're lumped together with Port Arthur. But the demographics, and I've been in that area a number of times, are really very different from each other, right? So you can't necessarily take an average of anything there and say that it's meaningful for one city or the other. And so you can run into that here too with the these synthetic estimates. The census actually has two models of synthetic estimating that they do. One is the small area income and poverty estimates. So again, this is based, and with these estimates, these take data from a lot of different inputs. So school districts, counties, states, ACS data is incorporated. I think you said, Chris, tax data is incorporated. So it's all incorporated into this synthetic estimate that's created. And there are one-year updates. So it provides one-year updates of income and poverty information. And then it can be reported out at school district level, county, and state. Why don't we do the other one, and then you can go to
the health
both.
Insurance?
Mm-hmm.
Okay. Show you the small area health insurance estimates. So the ACS, which I showed you earlier, has, if for all counties in Texas, in order to get them, because of small data size, you need 5 years of data averaged together. But by modeling the data, and they use a couple different inputs, they create an estimate, a synthetic estimate of what they think the poverty rate is for any given year. So they have this really new system. Actually, it's super, was released in August, so it's not very old. So interactive data and mapping tool. With their tool, you can get health insurance estimates at the county level for every county in Texas, something you cannot do from ACS. So here's 2010, and going into state selected. Okay, I want Texas. Include counties, include states, age range. Generally, for health insurance, they do under 65 years of age. You can select, though, 18 to 64 or under 19. You're limited in this. There's nothing I can do about it, but you're limited in what options they have for age ranges. All ranges, sex, all incomes, that's fine. Get data. And here you have an estimate for the number of uninsured for every county in the state of Texas, because they made a model. It's a linear regression model of estimating the number of people in poverty or with health insurance, without health insurance, for every county using economic and ACS data. They also have data that no one else has access to because they are the census. They have access to the person data that I would never have access to, but as you can see from this, we have uninsured rates at the county level.
Okay, yeah, so he just showed you the page, which is just this. And so I'll just tell you kind of what's available there. So starting in 2005, at the county level, you could see for two categories, all ages or under 19 years old, estimates of people who did not have health insurance coverage, okay? And then beginning in, I think what just got reported in 2012 was based on 2010 information, which was an estimate of people who had health insurance. And this can be categorized by, at the county level, age, sex, and income. So it's categorized in that way. And at the state level, age, sex, income, but also race and Hispanic origin. So, and that's available. And again, yeah, that's prepackaged. It's determined what's available. And then the previous slide was the small area income and poverty estimates, and I think that's at the same site, isn't it?
Mm-hmm. The SA, they're kind of related programs, because small area income and poverty estimates. It's also model based. Something that I never mentioned before, but everyone wants like zip code data. And zip code data can be very problematic, but turns out that tons of data is released for school districts, because school districts have budget planning. You know, there's federal dollars go to local school districts, so they kind of need to know what goes on in the school district. So if you want to know local area, a lot of times you can get school district information, but you cannot get zip code data. So if someone knows what school district is, or you can maybe work with that in your local area, that might be a viable option for you.
Tell me like what you could find, like Beaumont Independent School District covers the entire city. There's only one school district.
Okay, I'm on the school district interactive tables. Let's see, Texas. You want Beaumont Independent School District? There it is. Total population, relevant age 15 estimates for school districts, and relevant age 15 to 17 families in poverty. So we get the children in poverty because it's school district data. So they're interested in the children. So this data is not available for zip codes. So if you want like local, this is probably as local as you're going to get this estimate for. But create interactive tables. So, but if you want, here's Texas. Sorry, I'm scrolling through this fast, but I could have just gotten this from the main page here. State and county estimates for 2010. Create interactive tables. Texas. Continue. I want select all ages in poverty. You can also get a couple different ages here. Display data. So here's information on poverty, percent of population in poverty. As you can also see, I haven't discussed it too much, but there is a confidence interval around this estimate. So you can see how good they think it is. You want to go to the next slide?
Yeah. So that's pretty much it, you know, and now we'll just kind of open it up for questions. And Janice was introduced in the beginning. Janice Jackson, she works with the vital statistics data. But, you know, and I don't mean this as a sales pitch at all, you know, because I have plenty to do. But with regard to kind of navigating through the data or finding ways of getting the data that you don't see available right on the website. And again, I used this example earlier. I've worked with Janice several times on taking data that's reported by an address, which of course you can't have, but then aggregating that to something you're interested in, like your school district, right? So there's just one school district just in your city, and so any of that vital statistics data can be aggregated to your school district, so you know that you're looking for, you're actually seeing information that's only within your school district. We can break it down by zip code too. You know, sometimes when you know, it's just like drilling down, right? The more specific you get, or the smaller the area you get, your sample size may be so small, there may be so few instances of something that the data's suppressed, right? So you can't really use it. But there are a lot of solutions, you know, kind of behind the scenes with a lot of this data. So, you know, if you go to the website and you see data there are always going to be tables behind it. And it could be that, you know, if you call a particular group within CHS, that they can say, oh yeah, I've got that table and I can tailor, you know, something to exactly what you need or that's most helpful to you, rather than more generalities. And I think that's really important to come into play when you're doing a community assessment, right? Because that's really defined in a large part, I would guess, by stakeholders. So what your community assessment includes could be wildly different from somebody else's. And so the ability to kind of tailor a query and you know, get as much specificity as you can is probably important for the results, or the quality of the results anyway. So that's it. So if you have any questions about vital statistics data, you can ask Janice. These guys, obviously, they identified themselves to you. Probably don't want to ask me and anything about, except about, you know, geospatial analysis or map making, just because it's not my forte. But and you'll get a really basic answer. But that's about it. So I think we're just going to answer some questions now.
Does anyone have any questions about data availability in their area, we can move over there. Actually, I'm going to stay over here in case there's a demonstration.
3 hours of statistics is and data is pretty much all the mind can handle, I think, for one afternoon. But anybody have any questions for these guys? I'd like to thank them for coming in this afternoon and sharing this information with you. Questions?
Anyone want to know how much we charge?
You know, charging is, you mean you get charged for the data service? There are a couple of specific groups in the CHS that charge. I've provided services for public, nonprofit, within CHS, county government, and I have no pricing structure. So, you know, I don't charge anything. So until I'm told, you know, what I need to charge and, you know, this is how much and start charging, I don't. And I don't know, I think maybe Michelle, if she gets into a certain level of analysis, maybe she charges, but I don't think you guys do you, Chris?
Nope. I've had consultants request data from me. And I know that they're going and selling that information to someone else for $200-something an hour. But I charge the consultant $0.
We don't charge, but we will not do analytical work for another state. We've had this come across where someone wanted to compare a larger county to like LA County in California or something. We will not do an analytical work for another state. We will not do US analyses, and then everything else is fair game, but it is first come, first serve. So if we're working on a very large project for one group, it may be a while before we get to you.
Yes, ma'am.
What kind of notification, like for instance, you mentioned 4 o'clock you need it for the term, so maybe 2 weeks, 3 weeks, 4 weeks?
The question is, how much in advance do you need to put a request in?
It depends on what you're asking for. If you're asking for one single number, like how many people are uninsured in our county, we can probably get it to you pretty quickly. If you're asking us to do a full wide range of something, it's going to take a lot longer. So, I mean, it's something very detailed, like if we are aggregating zip codes or something, that's going to take us maybe even a month to do because it's very tedious work.
If you're combining local areas into zip codes and then doing some of that analysis, like if we have to start linking data sets together, that becomes really a time-consuming activity. But like that PUMS data set that I was showing you, that's like 45 megabytes compressed. I mean, it would take you at least a week just to understand what the data set is. But because I use it so much, it would take me like under an hour to get an estimate out. It just depends. But if I have to do modeling of something, I mean, your time constraint just went out the window.
Yeah, I agree. You know, I mean, it depends on the complexity. I can whip stuff out really quickly, depending on what you're looking for and how large a data set is, and do I have to go in search of other data sets? Or, you know, it could take a couple of weeks. But generally, I would say for GIS stuff or what I've done, it isn't going to take any more than that. It's pretty rare that it would.
And sometimes you're really lucky because we've already done the request.
For someone else. Yeah.
And that happens a lot with Vital Statistics, actually, because they get tons and tons of requests. And then someone will request like births by, they want fiscal year births, and this happened last week, and births by fiscal year. And they thought it was going to be this huge ordeal, and we had already done it. So, it was just sent to them.
Right, or even if it's a different area, we've already worked out the process, which may have been complicated, but now we've got it down.
So.
Well, Janice was telling me earlier that they've been doing like 90 requests a month, so, and that's Vital Stats alone. Oh, more than 90? What, 120? 100?
We have some shortages currently in our, we have some staff shortages.
We're missing, we have like 7, maybe 8 vacancies right now in our area, so.
That can hurt, especially if you're looking for nursing data, just warning. But I think everything should be sorted out by the time you guys actually request data from us.
Yes, sir. Do we keep hospital discharge data? That's in the Texas Hospital Information Collection area. Yes, sir. Yeah, that is one thing you do have to pay for by statute.
They do charge. The hospital survey unit charges, and the THCIC charges, and I'm trying to think if anyone else charges just for the data, not analysis, just data. Those two groups do. I know that. I'm trying to think of anyone else.
And the hospital survey they're talking about is the American Hospital Association survey with a number of Texas questions added to it. So that's why all hospitals have to fill that survey out. It's required by law that they do that annually. And just for your information, I am more expensive since I retired. Other questions? Yes, sir.
I don't know if this will be any help, because I don't know if anybody else here is from West Texas, but at the F. Hall Institute for Rural and Community Health, we do fairly comprehensive needs assessments on all the counties, pretty much west of Dallas, Fort Worth, and San Antonio, out to El Paso, every 2 years, including surveys of about 2,500 West Texas households, and those are free. You're welcome to them. They're already done. Just give me a call.
Other questions? Comments? Hardy? Hold on just a second.
What is the current status of health department staff in their ability to carry out some of the analyses that we saw presented to us today? And if it's up to speed, we're in good shape. If it's not, what do we do about it?
Well, within CHS, I mean, as Michelle mentioned, we have a number of vacancies. Most of them are centered in one group. And generally in the health department, I'm not sure. I mean, budget cuts are not a surprise to anybody, right? So certainly they've affected us. And so I think the more that we put on the web, the more other services we can provide. But I don't know that I don't feel like we are crippled in terms of being able to provide the services we talked about today. I don't even think it's for the most part, even a very lengthy turnaround if you were to ask us for data or a little bit of analysis or, custom tailoring query, something that wasn't available on the web. I just don't think it would take all that long.
I do have to mention that it is helpful to come up with a list of indicators that you're interested in. I've done a number of requests where it's like, we just want everything. And it's difficult when you have a survey of like 130 questions to give you everything. So to tailor your requests will definitely expedite what we give you.
I can make a comment on that too, because I work in a group that we do a lot of unique requests, I guess, and we get the laundry list requests and if you're going to do that, it's not actually a problem. Just we get 3 or 4 different groups that get the same request, and it seems like a mass email of 50 different things. And if you can maybe just call us on the phone before you send the email, so that we can have a heads up, or maybe we can set up a phone interview time, or not interview, phone time where we can talk about it. Because so often I'll get requests for information where what you're actually emailing is a thing that maybe doesn't exist, but there's something really similar to it that is very easy to get. So. We can still do all the requests. I don't think that there's a limitation on that. And there's no we just have one group, and it has nothing to do with budget cuts. It has everything to do with people, just attrition going on, and we just haven't hired new people back yet. They just all happen to leave at the same time. But call us up. We can work it out. It can happen. It's not a problem.
The area that they're speaking of is the Center for Nursing Workforce Studies. They've had a little turnover of actually the entire staff here within the last 2 months. But they're replacing all those just as quickly as they can. That included the director who took over as the director of the Office of Academic Linkages, Dr. Kishi. took Rick Danko's place in that position. So she's close enough to us where, you know, she can still provide some input to the remaining staff and some input into the hiring process that's going to come along quickly. So
I have a question on immunizations. Did you all cover that? Did you cover where we can get that data from?
There is some immunization data to be had, but it is sometimes very difficult to get it or like to find it all together. Janice, do you know some immunization?
Yes, actually on Michelle's presentation, the link does go to the DSHS Immunization Branch website. And on the website, they have, Michelle and I looked on Friday, I think, and they have statistics on vaccine preventable diseases. We looked at the table by state, but you could certainly call the program and ask them for a breakdown by county or city if you're needing. We also found information on immunization coverage levels by state. There were a few counties that were included in that, but again, I think once you contact the program, you can get information that's more specific to your need.
And I know with immunizations, with my work with them, typically they, I believe, rely on MTRAC for the child vaccinations, but then the BRFSS for adult immunizations.
Anybody else? Well, we thank you for your attention this afternoon and the interaction here at the end over the last 20 or 30 minutes. We would remind you that registration begins at 8 in the morning. The first session tomorrow is speaking a little bit about getting your stakeholders and other health partners together to start discussing the community health assessment and the community health improvement plan. And then we'll break for lunch, and tomorrow afternoon we'll be talking more about creating meaningful and usable community health assessment and community health improvement plan documents. So tomorrow should be a full day all the way to about 3:30, and then we would like everybody to come back in this room and participate in where do we go next, okay? So have a good evening, and we'll see you tomorrow. Thank you.